Good evening and welcome to Greenleaf's Dispensary's inaugural show, where we want to feature one of our prominent recommending physicians. And here tonight we want to welcome our esteemed guest, Dr. Karl Haydel Jr. So Dr. Haydel, welcome to the show.
Thank you.
Before I get started, I want to provide a backdrop to our discussion here tonight. The way that I met Dr. Karl was through his dad, Dr. Gerald Haydel. Back in 2019, when Greenleaf Dispensary was undergoing our licenses, one of the first few people that I met was Dr. Gerald Haydel Sr. Because I'm not from the area, Dr. Haydel was very gracious in allowing me to meet with him. Through that discussion, we had a long conversation, and Dr. Jerry got to know me. And one thing he always said, he said, "Omar, call me anytime. You have my word. Of anything that I can help you with, I will help you." To this day, Dr. Jerry has never went back, and I called him many times on many different topics. He always took my call and was always gracious in helping me with anything that I asked of him. So, Dr. Jerry, I just want to thank you for all the help throughout the years that you have given, not only me, but to Greenleaf Dispensary. Dr. Jerry was also a trailblazer in becoming one of the first physicians to become credentialed to recommend medical cannabis to patients here in the state of Louisiana. He not only was responsible for a lot of Greenleaf growth, but Louisiana medical marijuana industry as a whole. So another accolades among many that Dr. Jerry holds, and we can't thank him enough. So thanks again, Dr. Jerry. But tonight I want to have a discussion with you related to Outpatient Medical Center with his son, Dr. Karl Haydel, who is helping out Dr. Jerry with the practice. So Dr. Karl, welcome to Greenleaf's inaugural show. Please help our viewing audience learn a little bit more about yourself.
Well, I'm a anesthesiologist. I finished my residency in anesthesia at Charity Hospital in New Orleans. I went to LSU Med School in New Orleans and did my undergraduate at USL in Lafayette.
Sure.
And
yeah, well, I know you got a lot of extensive practice in being a doctor for a number of years. So what I wanted to do is having a discussion as it relates to common questions that patients call Greenleaf and ask, but they're more related to physicians. So as it relates to medical cannabis, what are the range of diagnoses that you normally see from patients that presents to you on a week-to-week basis?
okay, well, before I say that, I just want to say that I appreciate what you're saying about my dad.
Oh, absolutely.
Because, you can't not have this conversation without talking about him a little bit.
Yeah, absolutely.
Because he's such a pioneer. And he's pioneered a lot of things in his life. He was the first one to do laparoscopic gallbladder surgery at Terrebonne General.
Wow.
I'll never forget that when he brought the laparoscopic procedure there, and the rest of the surgeons looked at him like, "What are you doing, doc?" Well, and about 6 months later, can you show us how to do it?
Wow.
So he is a pioneer. So he's really some big shoes to fill. And also, I do want to mention about his generosity. When he tells you that, and brings you in and tells you he's going to help you, and he means it.
Absolutely.
And he follows through with his generosity and helping others. So he's, I can't say enough about him as a physician. I think he's certainly born to be a physician.
Absolutely. Absolutely.
So,
Absolutely. So would you, from your standpoint, on a week-to-week basis, what's kind of the common diagnosis that people present with?
I would say chronic pain is the #1 diagnosis that I see.
Okay.
And it's usually combined with some anxiety and some insomnia. We do get some people come in who have insomnia, and we have people come in with a lot of anxiety. We also see some PTSD come in. So I'll see patients who have fought in the wars who come in and they cannot sleep at night, and they still have nightmares, and the marijuana does help them with their sleep. It helps, it almost, I don't want to say it cures PTSD, but it helps with the aspects of them sleeping at night.
Sure. And that's a common thing that we see from patients who come into the dispensary as a common diagnosis.
Right. So
what you think from the age ranges? What kind of ages of the patients that
between 30 and 60 years old, I would say. We do see some in their 20s. We see some older than 60s. I mean, so it's really a big range. I have had some people in their 70s come in as well.
Okay. Let me ask this question. As it relates to patients who are on palliative care or on hospice, do you think medical cannabis can help them in their quality of life?
I believe that it can.
Sure.
It's not something, I've not had a patient, a family member come to me, or that I know of have come to my dad about hospice, but my opinion is that if medical marijuana helps them to be comfortable towards the end of their life, I see no reason why not to.
Let me ask, for those doctors, there's still some doctors who haven't gotten on board in the state as it relates to medical cannabis, but they have patients who can benefit because they've exhausted every other form of traditional pharmaceuticals. Can you refer patients to you to be able to get?
Yes, they can. Sure.
Nice. That's a big plus. Let me ask, as it relates to medical cannabis being used to treat patients as compared to traditional pharmaceuticals, what are the side effects comparison of medical cannabis as it relates to opioids or narcotics?
Well, that's a loaded question.
Okay.
You know, we can talk a long time about opioids and all the side effects versus all the different drugs, but I would say this about it, and I'll go with chronic pain. Let's start with chronic pain. Patients who have chronic pain eventually do the opiates, and they do get results from opiates, but over time, their tolerance builds up. Their liver starts to go into overdrive. The P450 system kicks in, and so they have to use more and more of the opiates to get the same effect, and they don't get the effects, and then it does have constipation as a side effect. It causes, there's physical dependency with the opiates, can have pretty serious withdrawal if you were to stop it. Sure. There's the benzodiazepines, which is another drug that's used for people with anxiety and sleep disorders. It's also highly addictive. The marijuana, and as a substitute for it, doesn't have the physical dependency that opiates has. It doesn't have the physical dependency that benzodiazepines has. So, and then the side effects, medical marijuana has actually side effects that are beneficial, such as if somebody's taking medical marijuana for anxiety, it's also going to help them sleep.
Right.
It's also going to increase their appetite.
Yes.
So there are patients who have come in who wanted medical marijuana to help with their appetite. So it's a multitude of benefits. So I would say that it's would be the lesser of all the evils.
Let me ask, being that you've been in medicine, do you think the attitude as it relates to medical cannabis has changed over the years in a lot of
I think
some physicians' opinions?
It's changed with me.
Gotcha.
I can say that it's changed with me. My attitude and my position on it was that when they were talking about legalizing recreation for Louisiana, I was not a fan of it.
Sure.
Because I don't know that our young children, our young kids today need another gateway drug, mood-altering substance to put in their body.
Sure.
However, since I've been involved in the medicinal marijuana part of it, I'm starting to see the benefits from a medical standpoint that I never would have envisioned. Because my thought is that, this is just one another big business that people are trying to make a lot of money in.
Sure.
And albeit people will make money in the industry, but what I'm seeing is the benefits from the patients themselves.
Sure.
And I did not realize how beneficial it is from a medicinal standpoint. And I do tell the patients that doing it legally and doing it safely, because the products that you have here are not contaminated.
Right.
And the products that you have here are consistent. And that if you get a product from Greenleaf last month and you come back to refill it, and you get another prescription filled, and you use the same amounts to get the same desired effects, you're not gonna get overdosed or underdosed.
Right.
But if you get stuff off the streets, you don't know what you
But
do.
you know what you get. Absolutely. And that's a huge point that we always tell people about the legal medical marijuana industry in Louisiana, is that it's highly regulated, it's recorded, it's documented, it's safe. We have certificate of analysis that provides all information as it relates to the product. It traces back to its original origin, what batches, you name it, it has it. So 0 contaminants, precise measurements of THC, CBD, and all the cannabinoids that are available in each and every product. And you have a recourse. If something goes wrong, we can trace it back. You can call Greenleaf and to remedy any kind of problem. You get it off the street, you can't call nobody. Fentanyl is out there, it's killing people left and right. So why would I take a chance with my health and well-being when there's a safe, effective alternative that you can purchase at Greenleaf? Lastly, Doc, I know your contact information is on our website, so if you want to reach Dr. Haydel at Outpatient Medical Center, just go to www.greenleaf-dispensary.com. Click the tab Doctors to See. At the top, you'll see Dr. Haydel, Dr. Karl Haydel. Lastly, Doc, what would you like to end this segment on as it relates to anything you want to speak of lastly?
I would say that medical marijuana is not for everybody. It's certainly beneficial to a lot of people. And I would say that it's worth a try for some people. We have people come in who have tried marijuana before,
Sure.
And not illegally.
Sure.
And so they already know how it's going to affect their bodies, and they know it's going to help them. And we also have people coming in who have never ever put marijuana in their system.
Sure.
And what I try to tell them that it's probably has the least side effects of any of the type of drugs we use for the health condition that they're trying to treat. So if they try it and they don't feel good, it makes them feel undesirable, then stop.
Sure.
But it's worth a try.
Well, I want to thank each and every one of you here joining us on our inaugural episodes where we feature each and every month our recommending partner. Dr. Haydel is highly qualified, long-standing in the community, and I highly recommend Dr. Haydel. Before you can purchase products or medication at Greenleaf, you must have a recommendation from a credentialed physician. Dr. Haydel is one of them. I highly recommend that you give him a call and see him. Thank you for joining us here tonight.